Thank you. Good morning. How many of you know someone affected by infertility? Maybe a friend, a family member, your own family member? Raise your hand if you know someone. You can look around too. So infertility is a heartbreaking journey that affects millions of families worldwide. Just in 2023, 1 in 5 babies were born to women who are older than age 35. And that's because more and more women are now delaying childbearing. But the decline of the egg reserve cannot be changed, not right now. And women with certain genetic conditions have an accelerated decline. And the best treatment right now for infertility is IVF. And for women with declining egg reserve, it has very low success rates. It's expensive, it's time-consuming, and for some people, it's lucky. They're lucky if it works. But IVF doesn't work for everyone. So what do we have to offer? Except donor egg, nothing else. And people want their own genetic families. So our solution is beyond IVF. It'll improve fertility success rates, lower costs, save time, and be personalized to an individual's genetic makeup. So we're going to start with one of the most common genetic causes of low egg reserve. And we're starting with Fragile X premutation. And this condition is affected by the 5' untranslated region of the FMR1 gene that has expansion of the triplet CGG to over 55 repeats, less than 200 repeats. And it causes a transcription that's abnormal and then translation into a toxic protein called polyglycine. And this protein causes inclusions and it causes direct cell toxicity of the granulosa cells and causes ovarian failure. And so our technology is going to be an antisense oligonucleotide targeting the RNA to prevent poly-G toxic protein synthesis. So how is it going to work? In existing IVF workflow, patients with diminished egg reserve either A, cannot even do IVF because it's not going to work, or they'd have to do multiple rounds of IVF cycles. Or they can have an ASO injection 1 to 2 menstrual cycles before starting any fertility treatment attempt. And then afterwards, depending on how they respond, either be eligible for IVF and maybe do 1 cycle, or they can have natural fertility restored, maybe with an ovulation induction cycle. And for those not desiring conception, they can get an ASO injection and then get monitored for hormonal response, and then after several months, maybe get another one, to eventually delay premature menopause, and this will be life-changing for women. What's the evidence? We've demonstrated that ASOs can target the granulosa cells of the mouse ovaries, here in yellow, and in primary human ovarian cells, it can decrease the